So my name is Larry Brandt, and I'm here today interviewing Dr. Tanaka, who is from Hiroshima University Hospital. And he did a study that has a somewhat long name, so I'm going to read it. It's an endoscopic prediction of deep submucosal invasive carcinoma. And he looked at the validation of the NBI, International Colorectal Endoscopic Classification. That's hard for me to say, so they abbreviated it as NICE, which for me was very nice. And the way they did this study, and tell me if I'm correct, is that you had medical students that looked at pictures of polyps and then went and tried to validate what the polyps looked like, their perception of that, endoscopically. So now we're using medical students to do this, and because you wanted to see how easy is it to train somebody. Yes. Okay? And I guess if you can train a medical student, you can train an endoscopist. Mm-hmm. How did you pick the medical students?
At randomly. In order to spread this classification, doctor who has no knowledge of this classification should be used easily and simply, so we pick up average students.
So you picked up a medical student who knows nothing.
Yes.
And you had showed them pictures of polyps.
Yes.
And then that was their total knowledge. And then they went and they then evaluated real polyps.
Website test.
Right.
This study is website test. At first, I show three typical endoscopic NBI view, and I explained in detail each findings.
Right.
So then they tried to web test.
And how did they do?
How did
Were
they
they good?
Yes.
The students learned.
Yes.
So you think this is an easy thing to learn?
Yes, this classification is very simple and very easy to understand, even for students.
Okay. And the classification, tell us what the classification is. There were 3 types of polyps.
Yes.
Okay. Type 1 was?
Hyperplastic.
A hyperplastic polyp.
Yes.
Type 2?
Type 2 is dysplasia to superficially invasive carcinoma.
A superficially invasive carcinoma. That would be less than 1,000 micrometers.
Yes.
Okay. And then we had type 3, which the NICE classification doesn't usually include, but you made it include that. And type 3 is the deeply invasive cancer.
Yes. This deep invasive cancer is not indicative for endoscopic treatment. This type of lesion should be treated by surgery.
And that would be why it was so important to do this, because if you look at a polyp and you can tell by this NBI evaluation that this is a polyp with superficial cancer, in which case I can treat it endoscopically, or deep cancer, in which case the surgeon should take care of it. That was why you did this study. Is that
yes,
correct?
That's right.
How do we do for serrated adenomas?
That's a good question. Serrated.
Thank you.
Serrated adenoma is a variation of a nice type 1 lesion.
A variation of a hyperplastic polyp.
Yeah. So serrated lesions, dysplastic part is bottom of ground. So from the surface structure, we cannot see detailed findings. However, recent study showed that this plastic serrated adenoma shows satellite pit pattern with irregularity.
A satellite pit pattern with irregularity.
Yeah. Some doctors call open type 2 closed pit pattern. But this is special validation of NAS classification. So in basic classification, we didn't put this type of lesion in NAS classification.
So to sort of conclude now, you think that this NBI is a easy technique to learn that can help us differentiate between hyperplastic polyp, polyp with superficial cancer or dysplasia,
Yes.
and deep invasive cancer,
Yes.
and therefore help in the management.
Yes.
And we're starting to get an appreciation for sessile serrated adenomas as well, right? Good summary?
Yes.
How long would it take somebody like me, who knows a little more than a medical student, but has never done NBI, how long would it take me to become an expert in doing this? Comfortable and accurate.
Difficult question.
A week? A month? A year? How many cases would I have to do to know how to do it?
If I trained, 1 day is enough.
So if you trained me, 1 day would be enough
Yeah. In practice.
in practice. So I'll have to come and spend the day with you.
Yeah. Please come to
Thank you
Hiroshima.
very much.